Hi, this is Randy Wyckoff, the Dean of the College of Public Health at East Tennessee State University. And a question that has come up a number of times is, when will we have a vaccine for COVID-19? And this question is both more complicated and, interestingly, more personal than many other questions. And as I'll get to at the end, actually each of us plays a role in answering this question. Let me start with, what is a vaccine? It's a product that provides acquired immunity. It's something that is given to you so that your body is prepared, develops antibodies to protect you against an infectious disease. There's different types of vaccines. They can be made out of a live organism that's been attenuated. It can be a dead or inactivated organism. It can be a part of an organism, possibly even in the future genetically created parts of organisms. Vaccines are critically important. It is estimated that vaccines prevent 2 to 3 million deaths per year. For many diseases, especially viral diseases, we don't have any treatment, so we have to prevent. And in many diseases, there's no other way to prevent it. Even social distancing doesn't seem to be particularly effective for some viral diseases. And the good news is some vaccines can provide lifelong immunity after just 1 or 2 doses, and vaccines have actually been known to eradicate diseases. And anyone who tells you that vaccines are not a net benefit to society is either misinformed or they're lying to you. We have to stand up for the fact that vaccines are a major step forward in protecting the public's health. So what has to happen before we have a vaccine for COVID-19? Well, there's really a number of steps. First, discovery and invention. Someone has to find something that looks like it will work as a vaccine. Then there has to be clinical trials. Then it has to be produced. Then it has to be distributed. And each of these takes some time. Now, discovery and invention is well underway. According to the World Health Organization, as of last week, there were 120 candidate vaccines being evaluated in different places around the world. Once there has been some preliminary information gathered on those vaccines, then you can apply to start a clinical trial. And typically a clinical trial requires first a submission of a new drug application. You say, hey, this is what information that we have on it, some safety information and so on. Then you begin a phase 1 trial with a small number of people. You're really looking for safety. Does this thing seem to be safe for humans? If that works well, then you go into a phase 2 trial, which may have hundreds of people. These are folks that are similar to the ones that you'd like to vaccinate. And then phase 3, large efficacy trials to really make sure this thing works and safe and effective. And then in some cases, you'll have post-marketing monitoring. So after the vaccine is approved, you'll continue to do some studies. Well, why do you do clinical trials? You do clinical trials for 2 main reasons. 1, for effectiveness, and 2, for safety. Effectiveness is, does it work? And safety, is this safe to give to a lot of people? Now, this is where things get complicated, because the question is, how big a trial, how long a trial do you need to assess effectiveness? Well, if all you want to do is see whether the vaccine produces antibodies, that's pretty easy. You can give someone a shot, you give them the vaccine, you see whether they develop antibodies. The problem is we're not absolutely sure that having antibodies is protective against anything. So really what you really want to do is, does it prevent infection? Well, with a low prevalence rate out in the community, you have to do a larger trial. You have to vaccinate people who aren't yet infected. They run the risk of getting infected, and then you test whether they've got infected or not. But even that isn't really what you want to know. You want to know whether it prevents disease. Does a vaccine against SARS-CoV-2 prevent COVID-19, the disease? Well, then you need an even bigger trial, because now we know that a sizable number of people who get infected don't have any disease at all. So now you need a bigger trial. And if you really want to know, does this prevent disease in the elderly and other high-risk groups, because they're the ones at greatest risk, well, then you need an even bigger trial, because right now, most of our elderly should be well protected by our social distancing and so on. So there's no real easy answer, except the more you want to know about the effectiveness of the vaccine, the bigger the trial you have to do. And then how big a trial do you have to do to know safety? You know, if you have 5,000 people in a trial and you don't see any problems, is that good news? What if you have a serious side effect that only occurs 1 in every 10,000 doses? You're not going to see that in a trial of 5,000 people. And yet, if you have to give that vaccine to half the US population, you're now talking about 30,000 serious side effects. And this case study was the swine flu vaccine back in the 70s, where there were 450 cases of Guillain-Barré and ascending paralysis after 45 million doses, so about 1 in 100,000. So you have to have a pretty sizable number of people getting a vaccine before you know whether it's safe. Then once all that's done, you have to produce the vaccine. You have to make enough doses to go around. Well, if everyone in the US needs 2 doses, that's 650 million doses that you need. If everyone in Europe, that's an additional 1.4 billion. And if everyone in the world needs 2 doses, that's 1.6 billion doses. That's a huge amount. And remember, every single dose has to be produced safely and predictably in an appropriate manufacturing facility. And then once that's done, you have to distribute it, which in some cases is logistically challenging, especially if there are people who don't want to get the vaccine. So even after a vaccine is developed, trialed, produced, and distributed, the question comes down to a single thing, and that's, do you want to take it? How safe and effective would a vaccine have to be for you to take it, for you to give it to your children, or for you to recommend it to your elderly parent? I am 100% in support of vaccines. I believe they have been a major advance in public health in the 20th and 21st century. They have changed the lives of people around the world. We've reduced the number of cases of polio by 99.5%. It is magnificent. But we have to understand that the process of developing a vaccine is a systematic scientific process. And as much as we want a vaccine, I am not in favor of rushing it out until we've done all the right steps. We know from years of experience that if we do it systematically, we do a good quality clinical trial, we produce it in good manufacturing practices, then we have something that can make a real difference. I'm 100% in favor of a COVID-19 vaccine, but I want to make sure we develop it in a safe and effective way. If you'd like more information on COVID-19, please go to our website. We have a number of short videos. If you have any questions, please let me know. I'd be happy to try to find an answer for you. Thank you very much.